Welcome to This Week in Health IT. It's Tuesday News Day, where we look at the news which will impact health IT. Today, job losses, telehealth, 5G, and much more. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. The country is transitioning, and so are we. We are now doing 3 shows per week instead of the 5 we've been dropping. We're going to have a show on Tuesday and Friday, as we did prior to the pandemic, and we're going to drop another show every Wednesday. We're going to continue to do a live show once a month at the end of the month. We will only do a few more episodes of the COVID series, and then we're going to put a bow on that and call it a series and put it into the archive. As part of that, we're introducing new cards that's going to match the website redesign that we did a while ago. We just decided not to redo the cards in the middle of the COVID series. We're launching a thing called Clip Notes that I'm really not allowed to speak about yet. We will talk about that in the next couple of weeks. I wanted to make you aware I'm speaking at the Atmosphere Digital Conference for Aruba and hosting a panel discussion with Dr. Chaudhry from CIO from Seattle Children's and Rick Allen, the CTO from Navicent. We're going to be doing a session called Healthcare at the Edge, the Convergence of Devices, Data, Patients, Providers, and Care. I hope you followed all that. We're extremely busy at this moment in time working to develop great content for the next generation of health leaders. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. It is their commitment to making this content available that has made the daily episodes possible. Special thanks to Sirius for supporting the show's efforts during the crisis. Okay, let's get to the news. Here's what my promise to you. It is, I'm going to do 10 stories in 20 minutes. I promise. Set the timer. Here it goes. I'm looking at the timer. Okay, 10 stories, 10 minutes with a so what for each one. Here we go. Over 10% of healthcare CFOs expect digital transformations to cut digital transformation spending. It's interesting, that article title, over 10% of healthcare CFOs expect to cut digital transformation spending, when in reality what they're saying is 90% don't expect to cut it. So here's what the article says. It would seem most CFOs understand that the pandemic has proved the need to speed up digital transformation initiatives to not only survive, but to prosper in the new normal. Doug Brown, president of Black Book Research, said in a statement, for CFOs eager to expedite their organization's digital transformation, the standardization and simplification leaders want their back-end processes are allowing for less complicated, faster adoption despite the times. Additionally, the survey found that 90% of the providers have embraced virtual care solutions. 75% have initiated highly patient-positive experiences, and over half have had to commence with layoffs and process changes. What's the so what on this? The so what on this is absolutely. There's a whole host of things coming out of this pandemic which are going to be silver linings, and some of that is going to be essentially that patients have experienced new modalities, and providers have. We've educated a whole host of people, huge amounts of people, on the value of telehealth, on the value of remote patient monitoring, the value of online scheduling. You name it. It's quite frankly, we were forced to do it, and now everyone's experienced it, and they sort of stepped back and said, "Hey, I actually liked that meal. That was actually good. I actually enjoyed that. Let's do more of that." So I think you're going to see that in light of some of the other stories that are coming up. So COVID-19, story number 2, COVID-19 impact on hospitals worse than previously estimated. Healthcare Finance News. A Kaufman Hall report looking at April hospital financial performance showed that steep volume and revenue declines drove margin performance so low that it broke records. Despite $50 billion in funding allocated through the CARES Act, operating EBITDA margins fell to negative 19%. They fell 174%, or 2,791 basis points compared to the same period last year, and 118% compared to March. This shows a steady and dramatic decline, as EBITDA margins were as high as 6.5% in April. So what? The so what of this is it's bad. It's not uniform, but it's bad. And mitigating factors, as we've talked about on the show before, if you had a lot of managed care patients, you would weather this better than organizations that didn't have managed care patients. There's going to be hospitals and health systems that have $1 billion in investments. Even though the investments didn't do all that well during the pandemic, they have rebounded nicely, and they're going to have some reserves to play with to come out of this. Some of the other health systems are going to struggle mightily. I don't suspect that we will see IT budgets increase. In fact, I think we will see pressure on IT budgets to contract, but we will see digital transformation, very targeted digital consumer experiences investments continue to grow. All right, story number three, Cerner hires a new CTO, Jerome Labat, Labat, Healthcare IT News. Labat has deep experience with cloud and software as a service. Most recently, he served as CTO for Micro Focus International, a British pure-play enterprise software and information technology business. Before that, he served as CTO for HPE Software, leading the cloud automation business. Prior to that, Labat served 20 years at Oracle, where he led infrastructure automation and development operation. Among his goals at Cerner is to build out cloud capabilities while integrating cognitive computing capabilities, according to the company. So I don't know what to make of this, to be honest with you. I wish I could give you a definitive. I was pretty high on Cerner last year. I thought their move to the cloud was good. I thought the partnership with AWS was pretty smart. I saw some light there. I saw some things to get excited about. I'm never excited when you're replacing the CTO, and and quite frankly, 20 years at 20 years at Oracle and what this announcement does not excite me as much as it maybe should. I don't know. I don't know this person all that well. I know that the Oracle background doesn't really excite me. The HPE background doesn't excite me. The Micro Focus background, maybe. Maybe this is the kind of person they need. I would hope for, the direction they were heading with AWS and the cloud seemed to me to be a forward-leaning, forward-looking, and then you just hired somebody with, 30 plus years of experience in the industry. There's something about this that doesn't sit right with me. I'm not sure what it is yet. I have no so what for this. I reserve the right to comment on this later. 5G revolution, unlocking the digital age. This is, Visual Capitalist comes out with these things, and every now and then I'll click on them and look at them. This was interesting to me, and I pulled this out for one reason. From 1982 to 1990, you had 1G. From 1990 to 2000, you had 2G. From 2000 to 2010, you had 3G. From 2010 to 2019, you had 4G. And 2019 to present, you have the advent of 5G. My so what on this is read through the hype. We have a decade. This is going to evolve over a decade. There is no reason to rush into this. I mean, yes, this is an exciting technology. It's an important technology. But for healthcare, it's probably an important and exciting technology for 2022 and 2023. That's my so what on that. Beyond telehealth, the virtual care technology trends that will transform healthcare. This is Healthcare IT News. Patty wrote this art. Patty Padmanabhan, who does consulting in the industry, whose stuff I like. He has a podcast as well. It's with Damo Consulting. Let's see. He wrote a handful of things. So I'm just going to pull out the 20 or 10 stories in 20 minutes. 3 main points. The rise of contactless experiences. As is often happens in major catastrophic events, natural or human-made, many societal practices change irreversibly. The pandemic has made us all afraid to touch any surface exposed to the public. So there's going to be a rise of contactless experiences, his first point. Second one, contact tracing. Inspired by the success of Singapore and South Korea, contact tracing applications on Bluetooth-enabled devices have been positioned as an effective means to track and trace infections to reduce the spread of COVID-19. And his third thing is remote monitoring and automated communication. Healthcare executives are more motivated than ever to keep their populations healthy in their homes. The rise of telehealth and intelligent remote monitoring devices now allow patient populations to stay at home and manage their chronic care conditions, avoid visits to hospitals, and communicate on a real-time basis with their caregivers. Here's the so what. Absolutely yes on the contactless experience. I'm starting to experience that. I had some furniture delivered. We moved into a new house. We got a new chair, and they delivered it, and the whole experience was contactless. I mean, they took a picture in the house of the thing. I didn't have to sign anything. I didn't even have to do the finger thing on somebody's phone, which, as you know, a phone is one of the just a complete carrier of germs and viruses. So I think that contactless experience is going to be a new thing in our culture. Contact tracing, I think, is going absolutely nowhere. I think it's going to be swallowed up in the political abyss. Again, not a technology problem. I think it's an adoption problem, and I think it's a politics problem. And again, not stating whether we should or should not be doing it. I'm just saying it's going to get swallowed up. We are not South Korea, and we are not Singapore. We don't have the same culture, and so I think that's going to get swallowed up. Remote monitoring and automated communication, absolutely. I think we're going to see the rise of the home as the new locus for caring for the aged. I think we're going to see people really try to stay away from going into long-term care facilities, stay at home more. I think you're going to see chronic patients start to wire up their homes with Internet of Things devices, and you're going to see a whole host of things happen around that. I think that's the thing to keep an eye on. It's really going to be interesting. Okay, next story. Medicare leaders call for expanded telehealth access after COVID-19. President Trump's top Medicare officials said Tuesday that expanded access to telemedicine should continue after the coronavirus pandemic recedes, and that officials are examining ways to act without waiting for legislation from Congress. I can't imagine going back, said Seema Verma, administrator of CMS and Medicaid Services, told STAT during a live virtual event. People recognize the value of this, so it seems that it would not be a good thing to force our beneficiaries to go back to in-person visits. Absolutely. Here's my so what on this. Seema Verma is arguably one of the most powerful people in healthcare. There are 64 million people on Medicare, and she is speaking as someone who holds significant influence. I wouldn't take this to the bank because she needs money to make this happen, but they're very creative, right? So people recognize the value, so it seems it would not be a good thing to force beneficiaries to go back. That actually was that officials are examining ways to act without waiting for legislation from Congress. Interesting, okay? So I made this point last week on the show that Congress is where you go to get money. Schoolhouse Rock taught us that that's where you go to get money. So that takes us to the next story. There are buckets of money. You just have to find them. There's so much money flowing around D.C. that you just have to find them and attach into them. So a step in the right direction for telemedicine, Medicare Advantage. A bipartisan budget act of 2018 allows Medicare Advantage plans to include additional telehealth benefits beyond what the original Medicare allows. In their bids for the basic Medicare benefits starting in plan year 2020, under this final rule, Medicare Advantage enrollees may have a great opportunity to receive healthcare services from places like their homes, rather than being required to go to healthcare facilities. MA plans will now have broader flexibility than is currently available in how they pay for coverage of telehealth benefits to meet the needs of the enrollees. These changes will provide MA plans with the ability to offer expanded telehealth coverage to meet the needs of their patients. Patients in MA plans have always been able to receive, you get the idea. As I said, Medicare covers 64 million, Medicare Advantage covers 22 million. So essentially, Seema Verma and team have figured out a way to tap into this money from the 2018 Bipartisan Budget Act so that they can fund a third of Medicare beneficiaries with telehealth. So telehealth isn't going away. Love it, learn it, integrate it, figure it out. Next story. Ooh, gotta get moving here. Seattle coronavirus survivor gets $1.1 million bill, 181 pages long. Michael Floor, the longest hospitalized COVID-19 patient who, when he unexpectedly did not die, was jokingly dubbed the miracle child. Now that you can also call him the $1 million baby. Total tab 1.1 million, a little over 1.1 all in, 181 pages. The bill is technically an explanation of charges. And in fact, because it's COVID-19, he will likely not pay anything. That will be picked up by various things, including money that was put aside for the CARES Act and other things. Why do I cover this story? It's just a reminder, it's an election year. I was telling somebody the other day, this is the oddest election year ever. You just don't even hear about it. Normally you'd be, the sound would be so high on this election year stuff, but there are so many things going on in our world. It is an election year. Healthcare costs are an issue. This normally would be a massive story in an election year, and it would become an election year issue. And it may still. The cost of healthcare, 20% of GDP, still too high. Approaching 20% of GDP, still too high. Cost to individuals, cost to businesses, still too high. So it's an election year. It's an issue. Just keep that in mind as we move forward. Next story, hospitals continue to struggle with job losses as other areas of healthcare rebound. Healthcare finance news. Overall, education and health services employment increased in May, adding 424,000 jobs after suffering a decrease of 2.6 million in April. However, the numbers also show that hospitals have yet to recover financially from the surge of COVID-19 patients and the loss of revenue from postponed or canceled elective procedures. Many were forced to furlough or lay off staff because the billions earmarked for hospitals in the coronavirus aid relief CARES Act, was not enough for most hospitals to operate at previous expense levels. To a certain, so what on this is, these are tough times for hospitals. We are going to tighten our belt across the board. Some health systems are really doing okay coming out of this. It's been interesting. I think some of it has to do with your market share, your essentiality in the markets that you serve. Some of it may have to do with the amount of money you decided to spend going into it. Some people really drug their feet going into the preparedness, saying, we know we can sort of make this transition when we need to. We're not going to, clearly they followed the state guidelines and whatnot, but they didn't spend a ton of money standing up additional facilities or even transitioning a ton of space. And so they didn't incur those excess costs. They did have the decrease in revenue. I'm just saying it hit health systems unevenly. The so what on this is that it's going to take a little while for healthcare to recover. Some people are saying, that actually some people I'm talking to, the numbers have recovered somewhat. It seems pretty simple for people to get back to about 80 to 85% of their run rate. But when you hear that run rate, keep in mind, it's different run rates, right? Percentage of ED visits, percentage of procedures, percentage of office visits, percentage of clinics and whatnot. So the percentages are different, and they mean different amounts of revenue and different amounts of money to the health system. Keep that in mind as you hear these numbers. You got to sort of balance them out. But I think getting back to 85% in general is something that is happening pretty quickly across the board. But keep in mind, 85% is not enough. They have to cut significant. We, as a health system, will have to cut significant amount of costs to stay ahead of that. Okay, and final story, and I'm almost delivering on my promise. At Stanford Children's Health, the telehealth bubble won't burst. Natalie Pagler, MD, Chief Medical CMIO, Stanford Children's Health. Time will tell what the future holds, and I expect some drop in the telehealth numbers as we go forward, but clearly we won't return to the baseline we were before the pandemic. There are so many stories of both patients and providers who have discovered unknown value in telehealth, and in many cases, telehealth may be the more optimal method of delivering care. We have had cases where our development and behavioral pediatricians are seeing children in their home environment and getting much more information about the development of the natural environment compared to the clinic setting. It's actually gotten to the point in which our division chief for development and behavioral pediatrics has said that going forward, the at-home assessments will be standard part of these evaluations. The so what on this is I agree wholeheartedly. Although it is primarily going to be a numbers game, it depends how much of this is going to get. There's two aspects of this, really. It's got to get funded. We all know that. So I should just stop saying it. It has to get funded in some way. It's a zero-sum game. You cannot, all of a sudden create all these new capabilities that doesn't get funded. But there's different ways to fund it. You can get actually paid for it, or you can drive out costs by doing things in a different way. Now, if it doesn't get funded, I mean, there's a case to be made that it is going to be hard to sustain these gains. But as you saw in the earlier story, Medicare Advantage is funded. I think you're going to see Medicare get funded. I think you're going to have new plans get developed by the payers, by the commercial payers, which have telehealth only type options. It's going to be an exciting time in healthcare, isn't it always? That's all for now for the news. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, or our YouTube channel. If you want to support the show, the best way to do that is to share it with a peer or send an email. Let them know that you're getting great things out of the show. Please ship back Tuesdays, Wednesdays, and Fridays now for new content. Thanks for listening. That's all for now.